Tell us about the work of the Community Blood Center of the Ozarks.
The mission of Community Blood Center of the Ozarks is to provide life-saving blood for our area hospitals. Our 44, at this moment, it's 44 local hospitals.
Now, Belinda, sometimes people get this confused. There's two different organizations in our city. We have in Nevada the American Red Cross, and we also have the Community Blood Center of the Ozarks. Are these the same organization, or what's the difference here?
We are a separate organization. We are an independent blood center, and the American Red Cross was responsible for Nevada Regional Medical Center's blood before 2015. But in 2015, Community Blood Center was given the responsibility to collect the blood for the hospital. And that's what we mean when a person gives blood. Obviously, you're doing a tremendous thing for your fellow man, but it all depends on what you want done with that blood. Do you want it to go anywhere, or do you want it to stay local for your local hospital? And that is the job of the Community Blood Center, just as our name implies. We are your community blood center, and your blood is going here for your friends and neighbors and loved ones at Nevada Regional.
How long has our hospital used the Community Blood Center of the Ozarks?
Yes, we went under contract with Nevada Regional in 2015, so that would be about 6 years now. And Nevada is a tremendous community, and it's just a matter of letting people know. They're obviously doing something good when they donate, but letting them know that Nevada Regional depends on you to give blood for the hospital.
I understand that nationwide blood banks are seeing low blood supplies. Is that true?
Yes, it is. We are seeing just a low donor turnout. Just overall, we're still all dealing with the effects of COVID, and blood donations, are down just overall, and that does not bode well for the surgery patients, because surgery schedules keep increasing. In fact, we have not seen surgery numbers like this for over 5 years. So we are challenged daily to meet the need of those area hospitals. I might go on to say that if someone has had COVID, they are able to give blood after they are have recouped from the COVID, and they are feeling well and healthy, and it's been 14 days. And also, if you received the COVID vaccine, the ones that we're aware of, Johnson & Johnson, Pfizer, and Moderna, you are able to give blood if you've had that vaccine. So that kind of helps clarify. Some people assume that they cannot, but they can give under those conditions.
And some people feel like it's painful to give blood. Is that true?
Well, it is a stick and a sting, but we've all had shots in our life, and you keep focused on why and what we're doing this for, and that keeps that stick and sting in perspective. What would we not do for our friends and loved ones? And it takes about 45 minutes to an hour. That's the entire process. The needle is only in your arm about 10 minutes, so that keeps that in perspective. But it's a stick and a sting, and it's the only way we can get blood.
Well, now, could someone get COVID or any disease by giving blood?
No, we are so far and above any of those kind of things. Everything is sanitized. Of course, everything is one use. All our equipment and the needles, of course, are all one-time use only, and everything's sterilized. Your arm is sterilized, so those chances are nil.
When do you folks plan to have your next blood drive here in Nevada?
Yes, we will be here in Nevada on Thursday, September the 30th, from 1 to 6. And we're using the First Christian Church's Fellowship Hall, which is, the locals know that as the old Aldi's building.
Good. So how can people register if they want to give?
Great question. Yes, we're all busy. Appointments are not required, but they are suggested because we are all busy. So if you would like to get a hold of the hospital, at the hospital, or you can go on our website, cbco.org, and put in the zip code or the First Christian Church location. I believe it's under the Nevada Community Blood Drive is actually what it's under. And you can see the appointment page there and choose a time that's convenient for you. Or you can simply walk in. That's certainly fine too.
And I think you can go to the hospital's website itself. Yes. And just click on donate blood.
Yes.
So,
yes.
Okay. Well, Belinda, do you have any closing thoughts before we let you go?
Well, I do appreciate you putting this information out there. You know, most people, number one, to summarize, they don't realize the difference between the two organizations, so thank you for letting people know the difference. And again, your blood is staying local when you go through the community blood center. The other thing is most people don't donate because no one ever asks. So we're simply asking, please consider donating, because we never know. We have to be prepared. We know there's going to be accidents, and fortunately, we know people with heart conditions, we know people with cancer, all need blood and blood products, and we never know when it's going to be ourselves or someone we know or love. So we have to be prepared with blood donations, and we need 200 units every day to meet the needs of our 44 local hospitals. So it's a tremendous responsibility, but we are so blessed that people understand in the Midwest. We understand taking care of each other. So we appreciate Nevada, what a fine community, what great work you do at Nevada Regional, and we're here and happy to partner with you.